Welcome back, everybody, to another episode of the Mid-Level Show. I am your host, Ben Rogers. I am with Kara in Knoxville, Fran in Johnson City, and we will be joined soon by Andy, who is in the Kingsport office today, but is also in the Johnson City office. For those who don't know, the Mid-Level Show is where we get the people that are inside of our offices seeing patients, and we go over their perspectives on this week's Dictations episode, as well as this week's Doctor's Note article written by Dr. Rogers and spoken by Dr. Rogers. And this week was a really interesting one, guys. It was on, the title of it was, When Should You Go to the Hospital? And it seems like a kind of an intimidating title, but I felt like it was super useful. And Kara, I just want to start with you because I know you have experience in the hospital. What was your initial impression on this, and what did you think Dr. Rogers was trying or attempting to say here?
I thought he made a very good point when he said that the goal is, if you think you had COVID-19, not to go to the hospital because of risk of exposure to so many other people that are in the waiting room, and how difficult it is in a busy waiting room to social distance. And so I thought that was a very good point that he made. You see commercials on TV, wearing a mask not to expose you, and really thinking about other people. So he made a very good point not to go, but he also made a point of when it was important to go, like if you were having shortness of breath, and it was a life-threatening emergency. So he was able to put it in perspective.
Yeah, I agree, and Fran, you can kind of piggyback on that. I felt like a lot of what he was saying is that it's a game you have to kind of measure out, and he's been talking a lot of patients through that, as well as I know you guys have. What was your impression? What did you take from the note this week?
Well, that one of the reasons, I guess the main thing I took was, one of the main reasons you don't want to end up in the hospital is you lose your whole support staff. You can't bring people in. You can only have one person with you. And when you are in the hospital, you really need that. You need a voice with you. And with COVID, everything with that has changed. So if you can be cared for through telemedicine and stay at home, then you can have your loved ones and your support there to help take care of you. But certainly that doesn't mean, like you said, definitely you want to go. If you're short of breath, you can't breathe, that's an emergency. But if you're just having some symptoms, you're better off making a phone call, finding out, and having your support able to stay with you.
That's so interesting you say that, Fran. The big thing that stood out to me was he said that it was a line in the note this week. The biggest tragedy of COVID-19 is that people are dying alone in the hospital. And, to me, like that was kind of at the meat of it. And, part of me is thinking that he's trying to protect people from situations like that. But I also know he's talking, a little bit about, the care that's happening in the hospital without having that patient advocate as well. And I'm going to let Andy in here. For all those who are listening on the podcast, we are letting Andy into our chat, into to this episode of the Mid-Level Show. Andy, can you hear us okay?
Yeah, can you hear me?
I can hear you. Wonderful. And Andy, why don't you jump on in here? I'll fill you in. We're talking about this week's note, and the note was titled, When Should You Go to the Hospital? And, Kara and Fran both talked about why the goal should be to stay out. And why don't you just give us your initial impressions on this note and kind of the timeliness of it, not only from a COVID perspective, but just in general. What's your thoughts on that?
Well, too, before we jump in, I just want to make sure, am I right side up or am I sideways?
You're sideways.
You are so sideways.
That's what I was thinking. So, yeah, I was like, well, first off, we should go to the hospital to fix things like this.
There you go.
So, A, go to the hospital if you feel sideways like I do. And if you're Yeah, we're right side up. It's totally fine. And Ben, those glasses, on point. Love them.
I've been, I'm in Kingsport today. We had an office meeting this morning, and I was excited just to debut these to the staff in Kingsport. And Kara, you'll see them tomorrow. You've seen them in person, haven't you?
I have.
And I've got my approval from you, so I feel great about it. Fran,
Well, also,
you're on the
too,
conference.
I feel like too, Ben, that you look like you're either about to read a book or do a procedure. I'm not really sure. So I think it's awesome. I'm really proud of you. So you could do both of those at the same time.
Just read the book before you do the procedure.
Yeah. Yes, you read the book and you did the procedure, Ben. That is spot on.
I feel like it's part of being the host here. I gotta look the part.
You do. You do look the part. And just an update from last week's, Ben has brushed his teeth this week, so that's good. Ben is looking at that dental health. I think that's great.
It's not just it's not just cosmetic. If we want to go back to last week, the dental stuff is not just cosmetic; it's preventative. Very important message. You guys need to check out that episode.
Okay, so in reference, I actually really liked the note today too, because growing up with Dad, he has a kind of a low threshold for going to the hospital. And when he tells you to go, you should go. So my experience, it's unrelated to COVID, but when I lived in California, I was catering and I thought I'd pulled a muscle the next morning. I just had this stomach pain, but I'd done a lot of lifting. We had rearranged a 1-bedroom apartment for like a 60-person wedding. So I thought I just lifted a ton. The pain I took, I don't even know what I took. I was like, I'll just take it easy. It started localizing and going to the right lower quadrant, and I was full-blown in appendicitis, and it had ruptured. But I wasn't going to the hospital. I had a low threshold, and Dad, I called him whenever he was talking to me. He's like, you need to go to the hospital now. So too, I feel like emergencies like that with right lower quadrant pain, probably go to the hospital. It can be appendicitis. Although we've talked about appendicitis before, mine had ruptured. I was a high-risk case being a type 1 diabetic. But two, Fran's son has gotten treated with antibiotics with appendicitis before, and we can avoid a hospital experience.
No. He was treated at the hospital.
Was he really? He went to the hospital?
Oh, yeah. He still needed to be in the emergency room and have everything looked at because it is an emergency. But they were able to send him home during COVID on antibiotics, and he's done fine.
Super cool.
That was my take of like abnormal stuff where you should seek help right there. Chest pain with radiation down your left arm, shortness of breath. With COVID, the big thing is if you cannot breathe and you feel like you've had contact and exposure, go to the hospital. You may need something that we're not able to do over the phone. Emergency situations. But two, Kara, you worked in the emergency room? Do you feel like too that we overextend? With my rotations in the emergency room, we had both ends of the spectrum where a stroke victim needed to be there immediately, and someone who just had not even they didn't need to be there for it.
Mm-hmm. Yeah, you read my mind. And sometimes ERs are able to branch off and do fast tracks where some of the non-emergent emergency room patients can be kind of resourced out and then save the other rooms for the more emergent patients. But it's also important to triage every patient, take every case by case, so that nobody gets looked over, especially when they're having COVID-19 symptoms. And I think places you go into, they're asking questions, and even with a questionnaire, there can be some that do fall through the cracks and end up testing positive for COVID. So it's more nasal symptoms, or, it's not classic. That's on these questionnaires. But I think it's important just a case by case scenario, and don't assume anything when you're taking care of patients. Take a thorough history.
I wonder if can we teach people how to, cases that need to be outpatient, because, the other thing is, like Kara said, when you're in the ER as a provider or as a nurse, like you got to take everything that comes in seriously. I wonder if we can teach patients, and I think that's kind of what he was getting at this week was, if you can be an outpatient or do things on an outpatient basis, do it. Is that something that patients can be taught? What are y'all's thoughts on that?
I think so. I think they can be taught that.
What do you think, Fran?
I do. I think there are some people who think the emergency room is their doctor.
Right.
And that doesn't make any logical sense. That is not what it is there for. So you should have a primary care physician and be seen before things get emergent. And I think that's one of the problems. I think some people just don't have any kind of medical care. And then when something comes up, it's like, oh, we'll just go to the emergency room. But that is not the answer. That is not where you want to go for most problems.
Well, what do we do about the access problem with primary care? Because I think that's something, and maybe that's where, we see, urgent care centers pop up all over the place. And I think that's the hole they're trying to fill. But Dr. Rogers mentioned this in the podcast about, part of the problem is it's so hard to get in to see your primary care physician. Andy, what do you think about that? Is there something, I know there's probably not an easy solution to that, but do you think that's a huge cause of the problem?
Oh, yeah. I think primary care is inundated with people right now, and it's hard for them to do something acutely. And two, but I feel like a lot of medicine is going to change with telemedicine. A lot of the things we can treat over the phone. UTIs, they should be treated pretty quickly and pretty effectively over the phone. Females are the ones that are getting UTIs. If a male has a UTI, it's a rare case and probably something that really needs to be looked at. But when you're having one and not having one. A urinalysis helps see if there's an infection going on. But I feel like access is huge. Urgent cares are helpful in that they're able to triage the things that you can't get into primary care very quickly. But I think too, kind of knowing and trusting your body. Your body is amazing in the way that it can heal itself. So I think we need to be better advocates too, on one end of really trusting what your body is telling you. I think you can start to learn, hey, this cold is going to go away in a couple of days. I need to up my modifiable risk factors, which is rest, which is good sleep, increasing your vitamins, and also taking note that obesity is there's things that we can take of on the preventative end that will help out and help mitigate the smaller things that you really want to go, like you feel like you need to go to the emergency room for, but don't really need to. I think that's where the patient education is. And really trusting your body. COVID's the same way too. A lot of people, I've had 2 buddies that have had COVID. I haven't been in contact with them. Okay. I promise. But they've had COVID and have been completely fine, and they didn't have treatment. They rested and they drank plenty of fluids and were on vitamins. Other people need the treatment right away. That's kind of the newer off-label stuff, the hydroxychloroquine, the budesonide, and they do well too. So it's kind of this weird in between of when do I need to go, when do I not need to go, trusting your body and saying, if I can't breathe, you need to go to the emergency room. You don't need to go to your primary care for that. You need to go straight there.
Yeah, I love what you said about the telemedicine aspect of this and kind of where we're heading from a healthcare system standpoint. And I think that was one of the points that he was trying to make is not only should we aim to do things on an outpatient basis, but also all the things that we can do through telemedicine and the technologies that are available. Fran mentioned before we hopped on here how she had a couple telemedicine consults today. I know Kara's done quite a few, and and I know Dr. Rogers is doing quite a few COVIDs over telemedicine, of course, and that to me is just fascinating because that automatically it increases the accessibility component dramatically, and it changes. And I think that would have a huge impact on the people in the waiting room at the ER for a sinus infection, And Kara, when you were in ER, was telemedicine a thing, or the urgent care centers a thing, or is this all kind of new?
not as popular as they are now, and that's when they developed the fast track for patients who were non-emergent. But now, there's these urgent care clinics that are more popular that patients can go to for outpatient care if they can't get into their primary care physician, and then they don't have to go to the emergency room, because they can have exposure to other things too while they're there.
Oh, absolutely. Absolutely. And I think, Andy, you're spot on, and I think that's been the message all along has been, stay healthy, take care of yourself so that you can take care of others. And I think if we have that as our North Star, we're going to be fine. I think if we, take our vitamins, we're huge on supplementation with the D, zinc, and C. We're huge on eating well, on getting your exercise, getting your sleep, all these things that are within our control. It's funny, you hate to make huge predictions like this would be, but, if everyone were to really take that seriously, one could imagine that we might not be in the healthcare crisis that we're in now. No one can say for sure, but if we all took that type of ownership over our health and took care of the things that were in our control, I just wonder if the obesity epidemic would be, I'm not even sure if you can say an obesity is an epidemic, but ignorant on that front. But I just wonder if it's still there. Fran, do you have anything to add to that? What's your thoughts, and then we'll wrap up.
I don't know. I got kind of lost with what you were saying, but I just wanted to go back to the telemedicine and the UTI. To Andy's point, I think, if a woman has had 3 to 5 UTIs already in her lifetime and she gets the symptoms, she knows that's a very easy thing to treat. You don't necessarily need to get, a urinalysis unless it doesn't clear up. But the patient knows when you've had something multiple times, you're like, oh, this is that same thing again. And I think that can easily be treated. If it's a first time thing and you're just guessing, oh, I think I have a UTI because I have all the symptoms my friend has. Well, no, then I think you need to come in and be seen and have a urinalysis. But when it's something you've had a repeated number of times, what treatment works for you, that is a very easy thing to treat through telemedicine. It does not need to go to an ER.
I think that is a perfect way to end this episode, Fran. We're gonna get going here. I know you guys got things to do, and Kara's got patients to see. Guys, if to the listeners out there, if you have not subscribed to our YouTube channel, if you're not subscribed to the podcast, please do. We're putting our best content up there every single week. We've got 4 shows. We've got Carb Watch, the Mid-Level Show, Dictations, and 5 at 5, which is a Q&A show with Dr. Rogers. So to check out all that, go to the YouTube channel. Performance Medicine Audio is on all your podcast platforms as well as YouTube, and we're posting everything on Instagram and Facebook. Guys, I thank you so much. Thank you for taking the time out to hang out with me and give this valuable information to our listeners. And as always, we're going to see you guys next week.
Thank you.
Bye. Thanks.